wanted to mention my upcoming personal development retreat for dentists called Roses and Thorns, or dentalgrowthcon.com. It's an all-inclusive event at the Eaglewood Resort and Spa in Chicago on May 18th to the 20th in 2023. Food, drinks, accommodations, and excursions are all included. You just got to get yourself there. And it's a no BS, no dress code, no booths, intense, fun retreat where we dig into your top 5% and bottom 5% in your life and career. And you're going to meet like-minded peers having some of the same struggles you are. But if you attend, you got to bring it. Everyone has to be open and honest and share and give advice and feedback, because your strengths may be someone else's weaknesses and vice versa. And we'll all learn from each other and come home with tremendous value. And we're also going to hold you accountable. So after the event, we're going to check in to make sure that you're following through with your intentions and goals. So check out the website, dentalgrowthcon.com. And my friend, Dr. Vilas Sastry, will be there. What's up, man?
Hey, how's it going?
So I'm doing well, and it's always a pleasure to have you on. Dr. Vilas Sastry, he's a dentist and an entrepreneur, and he founded Teledentistry.com. And he's also going to tell us about some amazing AI technology that he has coming up. But Vilas, I just wanted to first, before we get into AI and teledentistry, which anything involving AI, I'm in. I hear the words AI and I'm all in. But I want to hear just about your story, how you got into dentistry, and then how you founded teledentistry.com.
Oh, wow. Okay. That's a big one at this point.
No pressure.
Yeah, no pressure at all, right? Yeah. I got into dentistry after, I took an exam and got in. Not too sexy a story there. Unfortunately, no repeat failures and all that stuff. I don't have that to my name. But that being said, I definitely just love the profession, And once I got into private practice after graduating from school, and you and I went to school pretty much together at Boston University. That's how we got to know each other, obviously. And so after getting to private practice, it became apparent to me that there are so many different facets to what we do. It's not just clinical dentistry. There's the business aspect. There's also the insurance aspect, and what happens outside of that insurance aspect. And so I started looking deeper and deeper into those kinds of things, and I founded a dental insurance brokerage firm because I really wanted to get into the insurance industry to kind of understand how it all worked. It was extremely intriguing to me. We grew that company from scratch to a multi-million-dollar, dental insurance brokerage firm. We had about 3,000 dentists on the network, and supported by about 7,000 sales agents, from California all the way to Florida. And we did great. It was an amazing experience, and I learned a lot about how dental insurance works, what's the nuances of it, and why dentists hate it so much, as well as why patients hate it so much. And if it's hated so much, then why is it still there? It's an intriguing question. Everybody seems to hate insurance, but dental insurance specifically. But when you go and buy it, and you go into the market and you say, hey, what insurance would you like to buy? From a sales perspective, everybody says they want dental. It's a weird sort of a thing that we experience. And so for me, I looked at that and I said, there's got to be some way to kind of optimize that experience, and to make it so that we add features to the insurance that enable a patient to utilize the policy whenever they want. You see, a lot of times we would find that a patient would have a dental emergency, and then they couldn't find their dentist, or they couldn't get access to a dentist, whatnot. And so I came up with the concept of teledentistry.com, and essentially telemedicine for dentistry. And this was way before the pandemic, and 2017, in fact. And we pitched it to Medicaid in Nevada, and that was our first client. And we went right away from 0 patients to 300,000 patients. It was a bit insane. And our goal was very simple: helping people avoid the emergency room, when they have a dental emergency. So you see how it kind of morphed along the way. And that's typical of, any entrepreneurial sort of a journey, so to speak. You come up with an idea, you start digging at one end, and then you kind of don't know really where you end up at the other, but you do end up solving problems along the way. And soon enough, we had about 5 million patients on our platform, all from different states, all on Medicaid. And that was our job, was to basically help patients when they're having a dental emergency avoid the emergency room. And we would do a virtual triage, video conference, do evaluate the patient, and then prescribe antibiotics and pain medication as appropriate. No opioids, of course, and that would be sent electronically to their pharmacy. And then that's that. Now, the key thing is here is this: that same set of treatment that I just described would be done in the emergency room and would cost the state thousands of dollars, whereas we're just charging, dental rates, if that makes sense, for the same service. So the cost savings were just astronomical for the state. And that's kind of how we kind of got our start. Needless to say, COVID hit in March of 2020, and we now have about 50 clients, all different insurance carriers, and about 100 million lives on our platform that have access to our service. And so that's kind of where we are on that side of the business. And soon we'll discuss our AI platform, I'm sure. So,
Wow. So you were creating, much cost savings for the state, but also you were saving hospital beds or rooms for people that were actually really needed it, or emergency room spots. And instead of going in for a dental issue, this was being saved for someone that actually really needed it, that was having a non-dental emergency issue. And then you also hit the timing right. You started this before COVID. So you must have seen such a boom in your industry.
oh yeah, absolutely. We went from having one client, like I said, to 50. That's no joke, right? And that was all accelerated by COVID. No, there's no question about it. And absolutely, we hit the timing correctly. Although I can't say I really timed it in any way as such. We were just ready to provide a solution, and the confluence of events that took place, it just happened to hit. I wasn't anticipating a broad uptake of our concept or product all the way up until 2027, to be honest, 10 years from founding date. That was my timeline. And COVID, of course, accelerated that by about a good 7 years. And so that's kind of the way it kind of all shook out. And now we're facing new challenges, with everything that's happening in the market, with staffing shortages and whatnot, so.
Actually, I take that back. What I said, I mentioned, someone who really needs it for the emergency spot, but someone who's in, having an infection or tooth pain, they do need help. And if they weren't getting it, then where are they going to go? They're going to go to the ER. So would you say that was your mission with teledentistry, was to reduce the dental related visits in the emergency room?
Our mission and slogan here at teledentistry.com is taking digital encounters to in-person experiences. So that's really what we do. You see, we all have these digital encounters, so many of them, in fact, now, right? But how do you really guide that patient correctly to the correct in-person experience, And that's what we do. Now, if a patient, and this happens all the time when somebody accesses our service and they're talking to a live dentist via video conference, and the dentist will tell them, hey, you know what, you in fact need to go to the emergency room because the swelling has crossed the midline or whatnot, right? So those things still happen. It's those, oh, my denture broke. Should I go to the emergency room? Yeah, probably not. You could probably just see your dentist on Monday and they'll take care of it for you. So that's where we serve as a sort of a filter, and maybe a minor swelling that can be handled with an antibiotic and a pain medication that doesn't need to go to the emergency room. So it just depends. It's like clinical practice, quite literally. It is clinical practice, and we're doing dentistry. It's just virtual, and we're recommending people to go to the correct source for their in-person care. So that's really what we do, and that's what our mission is.
So you were solving a pain point with the emergency room visits and filtering out these types of situations, but then you're actually solving another major issue right now, and that's with staffing and people having enough staff to really handle phone calls. Tell me all about the Wisdom AI package.
Absolutely. So what we have built with our teledentistry system is, and this is after several years of work, I might add, where we combined teledentistry and the telemedicine principles along with artificial intelligence and the two different aspects. These are modern technologies, by the way, two different, very disparate technologies working in tandem create an efficiency that can be realized in dental practices. And that's what Wisdom AI is. So the artificial intelligence system sits at the phone level of the practice. So most dental practices are suffering from staffing shortages at the front desk, or you have enough front desk staff members, but they're getting burned out. So, and that's because of routine, almost like routine repetitive sort of tasks that take place at the front desk that just eat up their time. You know, how many times, if you actually sat at the front desk and realized how many times a patient or various patients in your practice call in just to cancel, modify, or book an appointment, right? That occupies almost 85% of your front desk's time. You know, that is an automated function that Wisdom AI can handle for you. And it integrates with most of the practice management software systems, enabling access wherein a patient who calls your practice now is ported into your practice management software system so they can book an appointment. Now, this is critical because it's up to the practice on what access they provide to the patient when they're calling. So that's a setting feature that must be determined. And if they don't want to do that, then they can always just have the patient fill out a request form, which also can be handled. The system we have built is a conversational AI system that we have named Wisdom. This system sits at the phone level of the dental practice and allows for a safety net for your front desk team, so that when a phone call comes in, if your front desk is busy with checking in a patient, checking out a patient, an insurance verification, or who knows what not, then that extra call that comes in doesn't get dropped or go to voicemail. Rather, now with Wisdom, your patient caller can actually get service to different aspects, the different types of features, you know? So Wisdom basically can answer questions such as, you know, like book an appointment. I have a question for the front desk. What are your office timings? What insurances do you accept? And I have a dental emergency. So these are just a few of the things that the Wisdom AI system can answer automatically for a caller into your practice. And that alleviates your front desk team from having to do these repeated sort of tasks. So just want to kind of give you an insight on as to that.
So, and this is not a human. So can you have like unlimited lines open where if you're getting 5 people calling at the same time that they can all be taken care of? Are these taking over for like missed calls, overflow calls, after hours calls? Is it all the above?
Yes, absolutely. So Wisdom is an automated system. It can handle unlimited phone calls that come in at the same time. So your office now is able to, let's say that's like I've run my own dental practices before. I had like 7 offices in Vegas for a while, and I sold that to a DSO. And I can tell you this personally, right? It's always when your staff go to lunch that everybody else is at lunch, and then they all call you. And so your front desk gets overwhelmed. Same thing happens at 5 p.m. onwards, right? Your office may be closed, and that's when everybody else is off, and that's where you have a surge in phone calls. So our system serves to offset that sort of a need to continuously hire more people during these surge moments, so that way your office is always answering phone callers and providing services. So that's how the system works. Plus, we have Wisdom is equipped with 30 languages. So take for a moment, you know, if you had if you had a front desk team member who spoke 30 languages, right? Just think about that for a moment, right? And maybe it's not, you know, maybe, I don't know if that's even if there's anybody out there like that. I speak a couple of languages, but even then, that's a lot, right? So with when you're looking for a staff member, or you're in an area that's, say, heavily Spanish speaking or any other language speaking, right? Then, you know, this system can answer and provide service in the language that the caller is speaking in. So, so it's a powerful system. It replaces the frustration type of work that people kind of go through at the front desk, and oftentimes leads to burnout, and you might lose the staff member because that's all they're doing is just booking and canceling and modifying appointments. And this sort of thing is just can be easily and quickly handled by an automated system like Wisdom.
You said, hiring more people before, but it's not easy to find people. It's not easy to hire people or people that are available and want to work or even show up for an interview. It's tough out there. Or you're helping the people that you do have not get into those repetitive conversations, which I can imagine for 8 hours can be a total drag. But it sounds like you're allowing them to also focus on, the more important issues like the patients that are in the office, instead of, having to quickly say, hey, hang on 1 minute, I need to get this call. Let the Wisdom AI take the call and let's focus on the patient that's right in front of you. Are these ways that you can help dentists become, less stressed and more efficient and productive?
Absolutely, without question, right? If your front desk person is, presenting a treatment plan for say $5,000 versus helping to cancel an appointment for something, tell me which one you want them to handle, right? Which should be their focus, So if your treatment planner is actually presenting treatment plans versus running around trying to answer the phones, right? Their mind is in two places as well, allowing them to focus on what's at hand and what's important is critical. It'll actually get the job done. I saw this all the time in my practices as well, and it was like, okay, how do we get our team to focus on what needs to be done, which is presenting treatment plans, calculating copays, collecting copayments as needed, so on and so forth. There's all these things that an in-person staff member should be focused on, so you as a dental practitioner can optimize on that individual's ROI. Like how efficient is this team member if all they're doing is a routine task at the front desk or present treatment plans for $5,000-$10,000 at a time. That's huge. So it's a huge ROI on your team's time. Plus, you're not burning them out. Plus, you're not forget about hiring people. You're not losing the people you have.
Man, I love what you're up to, and you're always thinking of these innovative ideas. And my man here has been through a journey and back, and he's really out there helping a lot of people, a lot of dentists. I want to finish with a 3-part question. Okay. So this is focus here. Number 1, how do we get a hold of you? How do we find out more? Number 2, what is the blocky discount for anyone listening? And then here's the big one. What advice can you give to any of the young dental professionals out there? And I can repeat these if you need it.
No, yeah, probably, right? So what was the first question again?
How do we find out more, man? You've captivated our attention.
So teledentistry.com, you just come to the webpage, third tab over, it says Wisdom AI. So check that out, click on it. It's automatic and we can implement it in your practice in literally less than a week. No staff training required, okay? It sits at the office phone level, okay? So it's during business hours. What we had in our practices and what we recommend to all other practices is let the phone ring. First, second, third ring. If nobody answers it, then it goes to Wisdom. This is during business hours. This way it gives your staff a chance to answer the call. And then after business hours, it automatically serves as your call answering service. So that way, if you do have a call answering service that's costing you an arm and a leg, such as some people I know, Dr. Block, you can implement this, and then there you go. Okay, so this is a very, very affordable way to accomplish those different tasks. The blocky discount is literally just that. You just type in the word blocky, okay, either capitals or all caps or all lowercase, and you'll get 1 month off on the back end of your subscription to the Wisdom AI platform. And boy, if I was to tell somebody that starting out some good advice, really what I'd say is focus on getting easy wins every day. Easy wins, you'd be surprised how fast those add up and allow you to focus on the more difficult stuff. So if you can get easy wins all day, and I mean, I'm talking like, what we do is fairly complex as it is as clinicians. And so if you can get an easy win in the day, pat yourself on the back, because that's not so easy actually. So in your mind, if it's easy, then good for you, and then just keep going for it, and over a period of time, you'll find that the very complex stuff also becomes an easy win.
Yeah, I think a lot of us, especially me, I was very guilty of this, is I would focus on the one bad thing that happened during the day, and I wouldn't celebrate, the 30 good things that happened. So, you dentistry is hard, celebrate the little wins, whether it's you did a beautiful filling or you made a patient happy. Focus on those things and not the one, negative thing that happened. Actually, Vilas, one more question about AI, about the wisdom. My wife says I'm emotionless and I'm like a robot. What is and my voice is monotone. What does the wisdom AI sound like? Is it sound like a person?
Yes, it does. It sounds like a human being. You can choose if you want it to be a human female voice or a human male voice. If you wanted to have a Latino not accident, accent. If you wanted to have a different type of accent, we have all those different features available. Obviously, it speaks different languages. And so we have that capability to offer that to a subscriber as well.
Awesome. Dr. Vilas Sastry, I am so glad you joined us, and I look forward to seeing you in the Roses and Thorns conference, which is in Chicago, May 18th to May 20th. Again, go to dentalgrowthcon.com. Dr. Vilas Sastry, thank you so much for joining us.
Hey, thanks a lot, Eric. Okay, always a pleasure.